kind of response or a webinar today that was at 4 o'clock. I don't know if any of you have heard of that, but they were just kind of going over the financials of the ADA. There's some like social media groups that are kind of very negative, saying how the ADA has lost a whole bunch of money. But bear in mind, they were kind of going over what has happened at the beginning of this year. As some of you know, the ADA and the UDA kind of transitioned from one source of payment of dues to another called Fontiva, and that transition was kind of rocky. So there was essentially like a 3 month span where essentially the ADA was not collecting any money, and they were just running their day-to-day finances off of um, their anyway reserves. So anyway, that seems to be fixed. They got all that kind of going, so they're getting the money collected, and they were just trying to be very upfront with how things are going. The long-term goal for the ADA is trying to be financially feasible, and for the last 15 years, they've essentially been losing market share year to year with less and less people joining the ADA, and that's due to many different reasons. Most notably, probably the transition from solo practice dentist to more of a group practice style type dentist, where they don't see the same need, I guess, as a local independent doctor or something for a big organization to take care of them. But I digress. But anyway, so the ADA is trying to change the direction to try to become financially feasible, and that's why there's kind of new type of ideas in the works to try to make sure that we are sustained as an organization, because as you know, a united voice is better for all of us long term, for our profession and our patients. So, but anyway, if there's any specific questions, I know the ADA is going to actually have that. I don't know if they're actually going to come out with another live webinar for everybody to listen to, or if they're going to just have a recording of it. But if you have the opportunity, I would recommend listening to that. If you have concerns, we actually have the new board of the new treasury or treasurer kind of go over specifics of the financials and kind of explain those a little bit better as to what's going on right now. But anyway, so that was that. But without any ado here, I'm trying to see if Val, are you on? Can you hear me? I know Val was out of town and he was going to try to join here. I see him on here. I just don't know if he can actually talk and share with us. Can't hear you still, Val. I can see that you're not muted anymore.
I think I have him a little confused. This is Becky because I'm also
Oh,
logged in on the UDA account.
oh, it's you. So it might be you instead of Val.
Well,
Okay.
he's on also because he's hosting, but I don't know why he can't talk.
Yeah.
No.
Okay. Well, I guess let's just jump into this real quickly. So first and foremost, I guess since Becky's already talking here, we're House Bill 81 is the anti-fluoride bill essentially, which essentially made it so starting tomorrow they're gonna not put fluoride in the community water. As you know, that we kind of fought very hard against that just for several reasons, but it
Paint
obviously
cans when you
didn't
came
work
back?
out.
Oh yeah, the peep. It was out in the
But
grass. Oh, I when I came home for lunch, I saw something right there, and I don't know if can you get it?
let's see.
Got
But
it.
anyway, so yeah, so that anyway, so that bill goes into play tomorrow, and we are, and I'm not sure, Becky. I'm going to give some time to Becky here to kind of talk about what the plan is going forward, because obviously we're going to have to transition to. I mean, obviously most of the dentists in the state have been doing this already, but go back to prescribing fluoride pills for our patients. And based on the area where you are and the naturally occurring amount of fluoride in the water, obviously you have to kind of adjust that schedule. The new bill is allowing pharmacists to have a little more control in this, and the fact that they don't have to have a prescription, or patients don't have to have a prescription if they go to the pharmacist. The pharmacist can actually prescribe, and the pharmacist should have all the data that they need as far as what dosing is supposed to be allowed there. But I know at the UDA we're working on, and Becky's working on a distribution prescription requirement or recommended amount list that hopefully we can get out to all the dentists in the state. So if they have any questions, they can have um, good information. Unfortunately, that's going to be based on your water district. So there's a little bit of work that has to be made there with how much naturally occurring fluoride you have in your system, in your local water supply. But Becky, do you mind taking a few minutes and kind of talk about what the goal is going forward and what the kind of plan that you and Lorna are kind of working on um, for fluoride in the future here?
Yes. So, Lorna Kosai is the past chair of the Utah Oral Health Coalition, and she is obviously very passionate about fluoride. She's been leading this charge against House Bill 81, and she's absolutely amazing. So the UDA website does have a fluoride toolkit on it now. It does have information about what the current naturally occurring fluoride levels are in the different water systems. The state is also the Division of Water Quality or Division of something is also creating a map that can be a practitioner can go in and put in your address, and that will give you the naturally occurring fluoride level also. So on the UDA website, there is that information. There is dosing recommendations from the ADA. There's fluoride facts. There's we did have a webinar last week about last Monday regarding how to talk to your patients about fluoride. That is also available on the website. You can watch that. That was put on by the Dr. Johnny Johnson and Mark Jacob from the American Society of Fluoridation. So that is there. Also, we have a link to the state website, fluoride website, which has a ton of resources. The UDA is also working with the Oral Health Coalition on a campaign with the title of "My Teeth Matter" or "My Smile Matters." My Smile Matters. Yeah, My Smile Matters, and so you'll see more information about that coming out. We're looking at doing some public awareness campaigns, some different things just to educate the public and then also to educate dental professionals about fluoride supplements and different options as far as that goes. So, is there any questions specifically about fluoride? I feel like that's all I talk about lately, but okay.
Okay. Moving on to I guess we'll cover the Dental Practice Act. Does anybody have any question in regards to what can and can be done by your hygienist starting tomorrow? And also, I guess as a result, I mean, in regards to maybe Botox placement by hygienists and what the requirements are for them there. Anybody have any questions or concerns about that?
Can you guys hear me?
Yeah, we can hear you.
I don't know much about this topic, so maybe you could just educate me real briefly about what I wasn't able to read the changes that were made. So all my hygienists are asking me about this, and I just haven't had time to go read anything about it yet.
Yeah, so essentially starting tomorrow, anybody that's properly trained dentist or hygienist that's passed what's called an approved course through Doppel. And I'm not sure exactly which courses Doppel actually accepts, and that's something that I think we need to figure out pretty quickly. But essentially, you can start having your hygienist being trained as of tomorrow to be able to place both fillers and Botox. So, I
Do
don't
you
know.
want me to comment that on that, Rod?
Yeah, please do. Oh, thanks, Rich. You're there.
Hey, so I've been at the Doppel meetings the last couple times they've gathered, and so the way that these rules are going to go into effect, the Doppel has 180 days to come up with the rules, and then once those rules are kind of established, then um, they will open up for 30 days of public opinion. And then after 30 days of public opinion, then the avenues will be established by those rules. And that's when individuals will know what those requirements are. So like example on Botox, there is no course approved by Doppel right now. They're trying to define those rules for how many hours a hygienist is going to be required to take in order to be able to do Botox. And I don't think fillers are part of that in the meeting that we were just at talking about it. So the same thing is going to apply with Botox. It's going to be probably I mean, the rules right now, the discussion is your hygienist needs to be a practicing hygienist with so many hours behind her experience. And they can't do Botox unless they are in a dentist's office. So they can't do like Botox parties and have all their friends come over and shoot each other up. That's not allowed under what the rules of what Doppel is going to say. But basically with Botox, they will have sounding like a 16-hour course that is going to be required for them to be able to go through and take in order to be able to perform that. And they can only perform Botox in the office if a dentist himself is also certified to use Botox. So that's the Botox rule. Or the discussion is going on right now, and they'll have more discussion on that June, I think 2nd is the next Doppel meeting. It's the Friday in June. I don't have a calendar with me, but so fillings is the same thing. Fillings, hygienists and or assistants cannot perform fillings until the rules have been established. And then what it's looking like with fillings is there's going to be course curriculum. There's going to be there'll be institutions that will get certified that will then be teaching these things. There'll be a written and a like a hands-on clinic or a hands-on like prep that they have to fill. So there'll be a hands-on portion to the exam as well. So that's what's kind of going on with fillings. And once again, Doppel is just trying to wrap their heads around what they've been asked to do. And we're doing a lot of educating with them about what terms mean. And then what's the last one? The last one is orthodontics, which you guys didn't bring up. So being able to remove ortho adhesive. So that one is already being done in ortho offices and in general dentist offices, apparently, even though it's illegal and has been illegal, specifically stated in code that they cannot remove things, especially using hand pieces. But so that goes into effect tomorrow too, but the rules haven't been established. So they still probably shouldn't be doing that if Doppel were really to get after enforcing the laws. But they're trying to figure out with the orthodontists and those that are interested in that, what that will look like. It'll probably not be like a 16-hour course. It'll probably be some form of portfolio and training that will have to take place for that and an exam. But they're still trying to figure out what that will look like and how it's going to be spelled out, and trying to make sure that everybody's kind of knows what they're allowed or not allowed to do. And then it's going to be by a certificate that they will be able to perform those duties. So hopefully that makes sense.
Thanks, Richard. So if I understand correctly, the House bill is just an effective date for kind of from the legislative side, but there's still something that Doppel needs to do and say, and then there needs to be certificates for each of these people that perform these functions. Okay, thank you.
You got it.
That's very helpful.
Okay.
So essentially, Rich is saying they're on the clock, is what you're saying. Doppel's on the clock right now.
So Doppel's on the clock. So Doppel usually doesn't have a May meeting, and they had a mandated May meeting that we were at last Friday. Then their annual, or they usually have 4 meetings a year. So their next one's the first Friday in June. And anybody can tap into those. They're super exciting. Just kidding. But they're going to have to add more meetings because 180 days. They got a lot of work to do, and they have a bill writer who will be putting it all together. And she's like, I really want to know. And there's just so much information. It's like trying to teach somebody, restorative, a 2000 level course to somebody who doesn't have a clue what anything is that we do. And so anyways, and Doppel, Lisa, who's over Doppel, I think Martin is really trying to do the right things, but she's also over 8 other professions. And so we're just one of the 8 that she's trying to supervise to implement the rules that the legislation has kind of gone into place. So it's kind of like legislation. I think the legislators just think this is super easy, and they'll just give it to Doppel, and Doppel figures it out. And then Doppel 100% relies on their dental board, as well as input from the UDA and from other just people who have vested interest in it. So.
Okay. Well, all right. Well, thank you. Appreciate that. So in other words, stay tuned, and we will keep you informed as soon as we hear from Doppel when some of these actual rules go into place. So, okay. Thanks, Rich. Val, the information as far as the new actually, are there any other questions? Sorry, before I ask Val, are there any other questions in regards to the Dental Practice Act? Because other than expanded functions, everything else does go into play tomorrow. Okay. Um, Val, do you mind sharing again about the changes to the insurance laws
Yeah,
tomorrow that will be implemented there with the
yeah.
state-run insurance plans?
Can you hear me?
Yeah, I can hear you now.
Okay, good. Because my mic was having issues a minute ago. I thought it was working, but you guys weren't hearing anything, and then I couldn't hear anything. So anyway, hopefully I got that resolved. So anyway, the insurance issues, without going into extreme details, the HB 23 passed, which was a correction from the 2024 legislation on timely filing. It gives 180 days for a dentist or a provider to file a claim with an insurance company. If it's over 180 days, they want to hear why it's taken so long. So there would need to be an excuse before they would, or a reason before they would legally start to review that claim. We thought that was quite a bit. It was fine. It was originally 90 days. It was supposed to have been changed to 180 days last year. They messed up and only logged it as 120. So this was just more of a cleanup act to get it to the 180 that it was supposed to have been. But if a dentist is waiting over 180 days to file a claim, there's bigger issues. So anyway, we thought that was an ample amount of time to file a claim. That was just cleanup. So HB 372 is probably the one you are, oh no, excuse me, HB 495 is probably the one you want to hear the most about. It kind of has four provisions. One is prohibits insurance companies from forcing write-offs. And so if, it makes it to where if the insurance isn't going to pay, you still essentially can charge the patient, for your services. So that was just kind of cleaned up. The virtual credit card opt-out issue, which we got passed a few years ago. Many of you experienced or know of situations where you opt out, but then for whatever glitch, a month later you were opted back in, and it just seemed like a revolving door back and forth for quite a while. Now the legislation says if you opt out, you cannot be re-opted back in without having written approval. So that should seal that door a little bit more. And in the legislation, it also says if you opt out of one, that can include them all. Not quite sure how that's going to work out, but that's kind of what the statute says. So we'll see how that plays out. The retro denials, that's where they claw back the money. The insurance company feels like they've overpaid you, so they say we want our $200 back or whatever for blah blah blah. And in the recent past, they have just taken that $200 from somebody else's claim payment, and sometimes it's been a nightmare, an accounting nightmare, to try to figure out where that money was supposed to have been allocated from. So anyway, this kind of cleans up that situation. So when a insurance company feels like they overpaid you and they want their money back, they need to now send you a letter that says pay us this $200 back, whatever. And you have 60 days to write a check and send it in, or then they could then just claw it from other payments if they if you haven't responded. But that at least gives you 60 days to work it out before they garnish the money back, and that way you keep your accounting straight and a few things like that. So that's the one aspect. And then the other thing we threw into 495 had to do with because we kind of felt like the fluoride issue was going south, even regardless of how hard we tried to fight it. And so we kind of threw into this bill the ability to distribute prescriptions from a dental office. So there's kind of two aspects to that. It got dentists included into the same thing physicians and a lot of others are, where you can distribute a 30-day supply of prescription meds from your dental office, but it's limited to a 30-day supply. So And that has the exception, or part two of that, is fluoride. Fluoride you can dispense at any time. There is a paperwork issue here and an application that I'm hoping to kind of explain this at CQI maybe extensively, but there is an application. It's called a license to dispense application that the dentists who are going to dispense out of their office need to fill out. And I haven't asked the question of Doppel yet, but it also looks like it has a $110, hopefully one time only fee to file and get that license so that you can distribute things from your office. This would be, you can do 30-day supply of antibiotics. It could be anything you would normally use, but when it comes to fluoride, you should be able to do that at any time. And I need to check with Doppel, make sure technically we're okay, that you don't need that dispensing license to do just fluoride products. So there's still some clarification that's got to be made on some of this, but at least that's the direction it's going. There are questions on any of that?
Hey, Val, really
It's
quick,
not. Okay. Yeah.
you
Go
may
ahead.
want to do a quick clarification regarding ERISA in case any members get asked that from their constituents. I don't want to muddy the water, but that's come up a couple times to bring more clarification to that, and that's a whole nother topic, but maybe a 30,000-foot view of that really quick.
If I understand what you're referring to, everything that we pass on a state level applies to state regulated plans. ERISA plans are federally regulated plans, and this doesn't necessarily directly affect those, although in Oklahoma and some other states, they're working on situations where it still does apply, state laws still apply to ERISA federal plans. Some of that is going to yet still to be determined. And on the federal level, they're trying to do some ERISA reform there as well. So to make it allow for these state plans to also be carried over to a national level. Is that kind of what you were looking for?
Yeah, that's kind of where I was headed. And let's say I have a local dentist come to me and say, well, how do I know which plan is which? Is there an easy way to make a distinction? I'm on Delta Dental, I'm on Blue Cross and Blue Shield of Utah. How do I distinguish those?
Theoretically, and we've worked with the Department of Insurance and other our legislators. If it is a state-run insurance plan, on the patient's ID card, it should say state regulated. It should say, oh crap, what's the other term?
Does it have like a UT sometime in the identification number?
I've only seen it on one card because I don't see everybody's card now that I'm not practicing anymore. But if you look at the card, it should be on one, very prominently on one side or the other, say state regulated. The insurance plans, we're all told they need to put that on there. So if it's blank and you can't find it, then there is a good chance it's an ERISA plan. But I guess the only way you would really know is to call them, and then hopefully you get someone that actually knows.
Yeah. I just want to make sure that the dentists understand that going forward so they don't think suddenly this all applies to every plan, basically.
True. This all applies to state regulated plans for sure. And we're hoping that it could be expanded beyond that.
Great. Thank you.
Len, you have your hand up?
Yeah, Val, does that dispensing out of our offices include or exclude narcotics and pain medication?
I think there's different, I'll be honest with you, I'm not 100% sure. I think it can, but I think there is also additional paperwork necessary for narcotics and such as that. There's like I say, there's just because this bill passed doesn't mean we don't have a lot of other questions to ask. But yeah, in fact, I was just looking at Stacy's note. The license to dispense form is through Doppel Dental Board, the pharmacy board, and it is. But you go there, and they usually want you to fill out that form online. You have to print it out and then write in dental and send it in because dental's not in there yet. They're to update their form, but it's not done yet. So anyway, we're still working to get some of these answers. Some of this is still a little bit unclear, uncertain on the fine details. Did that answer your question, Lynn? Sorry.
I will guess I'll answer for him and say yes. Hey, Laura, did you want to add anything as far as current status of the legislative committee and kind of where you are as a committee and any needs that you have? If she's listening.
I think she just got kicked out. I saw a thing that said that she left the chat. She's probably popped back in.
She's trying to get readmitted. Hang on just a second.
Okay. Yeah.
Oh, there she is.
Hi, sorry, I went to unmute myself and I guess I left. Sorry about that. Um, yes, we are looking for some more volunteers. We have quite a few roles and responsibilities that we're looking to fill for our legislative committee. They range from anywhere from one-time volunteer, a few hours to regular, consistent, monthly, participating. So there's a lot of a full spectrum of opportunities for anyone who wants to get involved. At this point, we have maybe 2 or 3 of those roles have been hopefully established, but we need maybe a solid group of about 8 or 9 to consistently volunteer. So we are really hoping that the people on this Zoom call or those districts who have someone who wants to be involved will be interested. So please email myself or Ben. We are going to have our next meeting in a couple weeks, and I'm hoping that we can get some more volunteers to step up for some of those roles that we still need to fill. The biggest things that we really want to focus on right now currently are really organization, because of course we have the fluoride situation going on. We have a lot of PSAs and stuff like that, but we will have some future legislation that is probably going to be brought forth next year in the dental realm again. There has been word that the hygienists are, again, of course, trying to pass another Hygiene Practice Act. So we will need some help with figuring out where dentists are needed to either talk to legislators, talk to bill writers, anything like that. So if anyone has any remote interest in anything legislatively or knows someone in their district, please reach out to myself or Ben. Ideally, I'd also like to have at least one person from every district. If we can get at least a representative from every district, I would hope that there would be enough people interested that we can have at least one representative, maybe at CQI, to give at least some sort of point person to talk with, so we can make our communication a little bit more streamlined between the UDA board and legislative stuff going on statewide and the districts individually. So if you have anybody in mind or you yourself would like to participate on our committee, please let me know. Yeah, we're hoping that within the month we'll have some assignments that we can then start to disseminate information a little easier. And if anyone has any goals for a legislative session in January, that maybe we can get started on that. Are there any questions or anything?
Okay, perfect, Laura. Thank you very much. Appreciate it.
All right.
Does anybody
Thanks.
does anybody have any legislative questions at all for us? Anything that anybody has brought up in your district? Any questions you haven't been able to answer? Okay, if not, I wanted to see if Armand wouldn't mind just sharing a little bit. We have a summer activity specifically to see if Armand's still on here.
Yeah, I am.
Oh, okay, perfect. Do you mind talking about the activity?
Absolutely. Thank you everyone for being here. My name is Armand. I'm a committee member of the New Dentist Committee, and this year I have the privilege of chairing the committee. And I have my good colleague Laura, who's been chairing the committee in the years past. And so this year we have an event coming up for all dentists on the 5th of June at Sugar House Park. And there's a flyer that's was shared through some communication from Becky, and we can share it some more with you guys. And we're really hoping anybody who can be there can attend, and we'd love to have you there. The food will be provided by the UDA, and so we just want to have a carefree, easy opportunity for everybody to gather around and get to enjoy the summertime and the Sugar House Park. And so we'd love for you guys to join us.
Okay, perfect. Thank you very much, Armand. Well, with that, that's pretty much, like I say, we just want to kind of keep you always informed. If you ever have any concerns or questions, or anybody comes to you with questions you can't quite answer, whether it's in regards to the UDA or the ADA, please feel free to send them our way. That's what we're here for. We're trying to be as open as we can, and we want to make sure that everybody feels like they are being represented and heard. So, with that, any other questions at all before we end? Val, you good?
Oh, well, I don't know whether to bring this up or not, but the internationally trained dentist thing is still active. I spent an hour and a half on a call today with Alex at Doppel in regard to that. I don't know, Jim and a couple others we had a Zoom call the other night about an alternative proposal than what Doppel's kind of coming up with, because their evaluation of a foreign trained facility, curriculum, various other things still leave so many holes in it that we're looking at possibly trying to just say, look, we're trying to evaluate the institution and start to try to evaluate the person, the applicant. And we're going to propose some ideas, and looks like we'll be on the agenda at the next Doppel meeting, which is like I think somebody said, June 6th on that Friday. Actually, no, this is going to come up before that. This is going to come up May 21st. Sorry, I get my Doppel meetings all mixed up here. There's several lately. There's been a lot. But anyway, so if you've got any questions on that, we think we've kind of got a proposal. Several of us have talked about it. We think we have a proposal that would probably please the license holders of the state, probably would keep us par with the other states in their licensing requirements. I don't know, Jim, do you have anything else you want to add to that, or someone was
No,
up?
I would just advocate for this plan. Val, you've done a lot of work, and it covers most of the bases. I think it is foundational. They've kind of been floundering, and I think this is a good way forward. So I'm supportive of it, and thanks for all of your hard work.
Thanks, Jim. And thanks, Val. Thanks, everybody, for being here, and hope you have a nice evening. And like I say, any other questions, if you ever have any, just feel free to give us a call. So thank you and good night.
Thanks, Ron.
Good night, everybody.
Thanks,
Good night. Thank you. Thanks, guys. Thanks, Val.